welcome to your Community Update. I'm Angela Stepp. Today's broadcast will be re-aired here on WSOT TV today at 5:30 p.m. and again at 10:30 p.m. and then additionally on Sunday, August the 9th at 10 a.m. and 5:30 p.m. Now joining us first today will be Bob Jackson from the Grant County EOC.
Thank you, Angela. Thank you, Grant County, and we'll get right into where we need to pick up. So as of today, Grant County Emergency Operations Center has been operating for 147 operational periods, basically 147 days. We have been in operation and continuing to monitor the situation and do what we can. So the numbers, as of today, 16 new cases reported today. For a total of 764. Total from the beginning, and we have been tracking, as we've talked before. I think we look at 14-day periods. So over the 14-day period, we've had 160 cases. So we are in a window of time where we have seen spikes throughout the period, and I'll get into that in just a minute, but. We are right now averaging about 11 and a half cases a day, which is way higher than what we were and certainly higher than what we want to be. So on July 10th, we noticed our first spike, and we still continue that today in a spike period. So over that period of time, we have been trying to figure out what causes these and where they come from. So some of the things that we do know, at 11 of the last 27 days, we have seen cases per day over 15, and about 7 of those have been over 20 cases. So in a couple cases, 25 to 27 cases a day. That's huge for a county the size of Grant County with our population. One thing we have been able to do in a lot of those cases, the health department, through their contact tracing, has been able to track some of these back to large events where people are unprotected. And that leads us to the whole conversation about PPE. We know that when people gather in large groups, unprotected, without PPE, we see spikes. We're able to trace that right back. So that's real live data for us, and it helps drive the message. The other side of that is some of the large events we've had where we know people have for the most part, have worn masks. We do not see spikes from that. So the PPE works, personal protective equipment works. We know that. We saw in the nursing homes early on in this pandemic. So wearing the PPE, wearing the masks makes a difference. And so we encourage that with everything that we have in us to do that. Rural America and the health department, and Dr. Moore will probably speak to this more, but we know that rural America is experiencing greater numbers than we did at any other point in this pandemic. So there's no corner to hide. It is out there, and we just need to be protecting ourselves. The other thing we're looking at is schools open this week. We have been meeting for weeks with many of the school superintendents, all of the school superintendents in Grant County, both public and private schools. The health department, MGH, everybody that needs to be involved is, and we have been communicating openly, working toward a plan. Each school has developed their own plan to deal with the COVID positive case, and it's honestly, it's not a matter of if that happens, but when. We fully expect that to happen, and the schools are prepared. We have a plan. We have a plan from the EOC. We will continue to gather that data, look at that, and then react accordingly when we have to. So the lines of communication are wide open. We're planning, or we're anticipating that, and people are in place to deal with that. Lastly, just let me finish up with good news, bad news. The bad news is we cannot protect you from this virus. It is not possible for us to do that as public agencies. Just not possible. The good news is you can protect yourself, wearing masks, avoiding large gatherings, unprotected. If you have to go into a crowded store or whatever, certainly wear your PPE. be prepared and do that. It does work for you. Avoid those at all costs. Washing your hands and everything we've been telling you all along. We know it works. We have the data now to prove that it does work right here in Grant County. It just universally applies. So with that will conclude the report from the Emergency Operations Center. And thank you very much, Angela.
Thank you so much. And so much wisdom there in wearing the PPE, the personal protective equipment, your face coverings, the mask, taking those extra measures to keep yourself safe. Well, joining us next will be Grant County Commissioner Mark Bardsley. Welcome.
Thank you, Angela. It's always good to be with you, and thank you for letting us come into your home again this afternoon and share with you some updates. It seems like we're working on a theme today. We're going to be talking a lot about wearing that protective equipment, those masks. We do want to thank all of our media partners that continue to get this information out to you in the community. And so we want to first talk about the governor's orders and the extension of the state of emergency. We're still in that 4.5 back on track Indiana program, at least until August 27th. Remember, this is a fluid situation, and we may see more spikes. We may see things that continue to extend that. So if it happens, don't let that surprise you. Don't let it frustrate you at all. The CDC, the government, the state are all working their very best in order to determine what needs to be done next to keep our positive rates low, as well as then get that vaccine and those medications out to us as quickly as possible. I want you to realize that, again, according to the governor's plan right now, August 17th, all state offices are prepared to be open to the entire public. At this point, they're still doing a lot of by appointment only in state government. That's not true of the county. We are open for business at Grant County. But August 17th will be the opportune date, at least right now, to be able to go back to all the different departments for the state of Indiana. I want you to also be aware that the governor did make an extension on the eviction moratorium. Up until August 14th next week, the end of next week, those of you who are having difficulty paying rent or house payments, you can talk to the Community Development Authority, the Housing and Community Development Authority, and they will assess an application for you if you need to have some help with housing. And also as well, the state is encouraging you to make sure that you talk with your landlord or your lending institution to try and work on a payment program so that this process can go quickly and keep you in a house and in shelter. We do have positive news and negative news going around quite a bit. Some general trends at the state level as well as the county level would indicate that our mortality rates are moving down. The more people we test, the more positive cases we find, that kind of changes the mortality rate. And actually, for the first time in my calculations, we are actually just below the state mortality rate, which is a big change from what happened at the beginning when we were much higher than even the state mortality rate. So that's good news. But again, we expect the virus to continue to be around, more people to be diagnosed as positive for the COVID. So just a thought process for us today. We have added or refreshed our vocabulary with words like pandemic, infectious disease, transmission, positive cases, mortality rates. 7 months ago, we were looking at the beginning of a new year with hope, with expectation, and little did we comprehend that there would be a transformation in what would happen to our culture and our society in a 7-month period that we have today. Life-changing has been for sure these last few months. There's a current debate going on how to handle the next few weeks and months as we deal with the spread of the virus, and it will continue to spread. We just have to be aware of that. Americans are sharply divided on how to manage and to react to the virus as it threatens our community and it threatens our world. And so, again, the major theme I think that most of us are talking about today is it is very important that we continue to wear our personal protection equipment. that mask, using our social or physical distancing is very, very important. I just want to share with you 5 reasons I believe that we need to continue to wear our masks. First, as Mr. Jackson's already shared with us, it has been proven to slow the spread. It's incredibly important. Face coverings do slow down that transmission opportunity. And I want to encourage you to do that. Another reason for wearing masks is that it keeps our businesses open. As we move in and out of business, as we are doing our transactions, local businesses have been there, whether it's the local carryouts for restaurants, whether it's our food, our groceries, some of the other needs that we need to keep going. They've been there for us, and we need to be there for them. And part of that is keep them open by making sure that we don't transmit the disease. As well, another reason is we need to protect at-risk Hoosiers. Those who are 65 and older or have health conditions, we, by putting on those masks, help in keeping that transmission low, or the opportunity for transmission to be very low. Again, another reason is it keeps our families safe. If we're out in the community and we bring things back to our own homes, we may spread that contagion. We don't want to do that. And again, we're going to hear from Dr. Lindsay here in a little bit, but it's getting our Hoosier students back to school. And those precautions that are taking all across our school systems, that is going to help. We need to keep wearing those masks. So, as I've said all that, here's my thought that kind of ties us in spiritually. Romans 12:10 and 11. Be devoted to one another in brotherly love. Outdo yourselves in honoring one another. Don't let your zeal subside. Keep your spiritual fervor. And that second part of the 10th verse says, outdo yourselves in honoring one another. I can think of a lot of ways to honor and encourage people, but one of the best ways, at least right now during the pandemic, is to put that mask on and prefer one another, honor one another. We'll keep our germs to ourselves, and they'll keep theirs to theirself, and we're going to succeed as we continue to work together. As always, be safe, be steady, be strong. Thank you.
Thank you so much, Commissioner Bardsley. And joining us next, I'm happy to welcome back Dr. David Moore from the Grant County Health Department to share with us today. Welcome, sir. It's so good to have you here.
Thank you, Angela. Thank you for being with you, and thank you for inviting us into your home to do the sharing today. So, representing the health department, this is a medical problem. It's a medical emergency that has hit our community as a virus that is new, came, and it hit the human body. Same virus is out there, same human body. If we continue to do what we did before, we're going to continue to get the same problem we had before. We went through a whole lot in cutting back, and with that, the virus slowed down. Didn't go away, but it slowed down. And now we try to discover what is the new normal. What's the new things that we can do that can contain this virus? If we go back to the old normal, we're going to get the old thing. It's going to be a new thing that is here. And we've seen lots of examples of what works. We've seen what works here in our country. We've seen what works in other areas. The biggest thing that we have here that we can do is social distancing. We know that it's a droplet spread primarily, and that within 6 feet, it's hit the ground and it's there, and it's not going to do very much. In less than that, it can't. It can aerosolize, but that's not the major thing. And that whenever you are around wearing a mask to protect others from your droplets, to protect you from their droplets, we can bring this thing under control. Commissioner Bartley said that this is in large part, there's a big philosophical divide that we have in the country. There are opinions that are widely spread and widely separated about what is this? Is this for real? Is this a hoax? And is this what's going on? And as we look at the national numbers of people who were alive that are now dead, including my relatives and other things, there's some of us who believe this is a real problem and that we need to deal with it, and we know how to address it. There are countries in Europe who were facing huge problems, who have changed their behavior. They found that new normal, and they've brought it under control. It lets us know that this is something that we can contain and that we can do something about. And we're about to embark on a new phase now. We're to take our most precious packages, our children, and send them off to school and try to find a way, how can we educate them? How can we keep them in social networks that keep them growing and keep them safe? We also have teachers who've been there for years, who love their children, love our children who are there, that we need to be concerned about them. Many of them have risk factors, and how can we keep them safe? How can we do this for the entire community? We know how to do this, Grant County. We know how to do this, America. Let's do it. If you don't do it only for yourself, do it for that neighbor, do it for the ones that are there. We can get through this together. We know how to manage this virus. There are lots of challenges. There are huge challenges that we're going to have, and as we go through this. And I ask that you pray, that you trust in those who've been entrusted with our children, and let's do this together. Let's get through this country together.
So good. Thank you so much.
Thank you,
Angela. That. You know, he makes a very good point. We have to be diligent in our intent to be protective of those around us and keep ourselves healthy and well also. And that does involve things like wearing face coverings and washing our hands and taking those protective measures. And a little proactive effort can go a really long way in controlling the spread of this. Now, joining us next, because it is the first day of school, I am very excited to bring on Dr. Brad Lindsay. He is the superintendent of Marion Community Schools. Welcome, Dr. Lindsay. How are things going right now? First day of school is off to a start.
It's really off to a very good start. We're so thankful. I know there's been a lot of preparation and a lot of prayer. We've been planning. We've been planning for 4 months. And so now it's time to start school, see where we are, and begin to problem solve along the way. But so far, it's off to a great start. You know, Angela, our educators, they answer the call of education, of caring for children. And so our educators are so excited to be able to connect with our students back on campus or through our giant online academy. And they are so excited. And it's so important. And also, Angela, right now, sometimes school starts and maybe we weren't quite ready, but it is time because it always starts earlier and earlier, it seems. So now our schools are open. Families, you can still enroll your children. All school offices are open. You may come in person to go ahead and enroll. We're ready to welcome you. Or you can make phone call. And so you can continue at-home learning through our giant online academy, like just over 1,300 of our Marion Community Schools families children are, or on campus for in-person learning. We're going to continue to work with our families every single day. This year, more than ever, it's so important to communicate and to collaborate and to cooperate. We're here to meet your needs and preferences during these COVID times. But beyond, and we can't wait for the beyond. But it's so important. But through this COVID time, we heard from Bob Jackson, excellent leader for us in our emergency management. We heard from Commissioner Mark Bardsley, providing excellent leadership and strength of leadership, and Dr. David Moore in our Grant County Public Health. I mean, they have been faithful the last 5 months. But together, it's really important for us to use our common sense. As educators, we're going to use our education sense. We are going to follow the governor's orders. We are going to follow the recommendations from our state health officials. We're going to work so closely with the Grant County Public Health, which we have. As you know, even this summer, we have had a few student athletes, or we have had staff that we've had a few COVID positive tests, and then we've had quarantines. Now, almost all of our staff is off quarantines, although we still have, starting the first day of school, with a couple still on quarantine. That's just the way that that's going to be. But understand that this is whenever we hear of a COVID positive case, we've either heard that directly from Grant County Public Health or we're contacting Grant County Public Health. And then we'll do contact tracing immediately, and then we will communicate immediately. Because what's important to us is the safety, well-being of your children, the well-being of your children, but also all of our staff. You heard Dr. Moore say, we also care about our staff who are called to serve our children and our families. We're just all in this thing together, and I'm so thankful for the family support, our educator support, and the community support. Also, Angela, we just had shared last week, one of the reasons why education is so important is because we're preparing our children for the future. Our children are our future. And the class of 2020 just ended, and they're well prepared for the future. World changers with our advanced placement, college board tests, with all the college credits earned. That is time and money. Getting into colleges of their choice and on scholarship, colleges, our Marion Giants class of 2020, colleges like Georgetown University, University of Chicago, Notre Dame, Purdue University, Ball State, Indiana University, the Westmont, locally, Ivy Tech, Indiana Wesleyan, Taylor. We're so proud of them, but that's why education is important. During this COVID times, communication, be able to get the communication out like our local media does so well, and our local media brings the truth, or like our healthcare system, training for healthcare, training for technology, training for innovation and manufacturing of getting the PPE. I mean, we are reinventing ourselves. This is a time of innovation because innovation is necessary. This is a time for us to continue to be flexible and cooperative. This is time for us to be patient. Families and community, we've had so much help and we've prepared for 4 months, but now we're implementing the plans. And you know what? It's not going to be perfect. Every single day, something may not go the way that we had hoped. So we're going to have to problem solve together. We're going to have to communicate together because our goal is to provide the best learning experience, safest learning experience for our children and our families. And so we're just going to have to work it together. But I've been in the business for over 30 years of education, and I love it. And I love Marion. Angela, I chose with my family to live in Marion, to serve in Marion, to worship in Marion, to play in Marion, to shop in Marion. And I'm the superintendent of Marion Community Schools. And I'm proud of the city of Marion. And Marion Community Schools, we are this city's public school system. This is our community. We're fully invested. We live here. We want the best for our families and for our children. Why? Because our children deserve that. Our children are our future. So when we put our investment into our children and education, education is the economic engine for any city or community. And with Marion Community Schools, with Ivy Tech and Indiana Wesleyan locally, that's a public system of PK through Ivy Tech, through would be like grade 14, associate's degree, or we have a great private school, higher ed opportunity, Indiana Wesleyan for bachelor's, master's, and beyond. So this is our community, and we want to serve. We're proud of our culture of achievement. We talked about the great things the class of 2020, and you know what? The seniors last year, with COVID hitting in March, that was a different experience. But guess what? Our class of 2021, preschool through 12th grade, this is their culminating year. They're the first class ever, graduating class ever, to enter the year underneath COVID. This entire year is going to be different. But we talked about the great success of the class of 2020. You haven't seen anything yet. Because based on how our class of 2021 is coming into the senior year, they're ready to even take that achievement to the highest and next level. I'm so thankful for that. And Angela, as I would just finish this time today, it's going to take all of us working together. All of us individually are important, but when we come together tight as a fist, working together and fight this fight the right way, we can win. Bob Jackson, Emergency Management, gave us solutions. Commissioner Bardsley giving us solutions. Dr. David Moore in Grant County Public Health giving us solutions. All of us working together. Thank you for choosing the city of Marion and Grant County to live. And thank you for honoring one another and caring for one another. We're excited about the start of school. We need school, and we need your continued help. Thank you.
Thank you, Dr. Lindsay. As he speaks on the importance of open communication, that's the whole reason that we do the community update here. And we'll continue keeping this open line of communication to you going for as long as it's needed. And I'd like to say a great big thank you to the local media outlets that are partnering with us, the Chronicle Tribune, WBAT, the News Herald, and even the City of Marion. Layla Price Bodkin is helping to get the word out. So we thank you to everybody who is helping to spread the word. And today's broadcast will be re-aired here on WSOT TV at 5:30 p.m. and then again at 10:30 p.m. And then additionally on Sunday, August the 9th at 10 a.m. and again at 5:30 p.m. Well, that's all we have for today. Stay tuned for some more quality family programming that you can trust right here on Sunnycrest Outreach Television.